Okay, so I'm going to go ahead and just open this up. We still have people joining us, but I want to say happy Wednesday in January. We are delighted to have Lisa DiFranza here today to talk about the benefits and the differences between Social Security disability insurance, supplemental security income, and Social Security survivor benefits. So we're going to learn the effects of earned income on the amount of benefits received and talk about the entitlement program, SSI eligibility, and Medicaid eligibility. So Lisa has spoken before at one of our meetings. She is the founder and CEO of DiFranza Law. She started her private practice in the area of guardianship, guardian advocacy, and special needs planning by volunteering in the Jacksonville Area Legal Aid. And then she continues to lecture on advanced directives and topics of this nature. So we are going to let Lisa say hello, and then I will bring up her PowerPoint.
Great, thank you. Thank you, Dina. And of course, thanks for having me. My husband can't stand it when he's like, why do they have to get into that? And I said, well, they need to thank the people who were having them there. So thank you.
Yes, yes. Okay.
But anyway, yeah, so I'm excited to talk about this topic. It is always a hot one in any of my consultations and cases with guardian advocacy. So I'm happy to get started.
So can y'all see the screen? Can you see it, Lisa?
I can, yes.
Okay, good. All righty. Well, I'll go ahead and let you get started and let me know when you want me to forward.
Great. Now I put basic on this because it is just a basic presentation. We'll definitely go over some questions, Q&A at the end. If I have a question that's related to what I'm talking about at that screen, then I'm certainly happy to answer questions as I go along, because let's make sure we're all, it's better to me, I feel like it's better to stay on topic with all the questions when we're there.
Definitely. Okay.
All right. Hopefully, my purpose and objective in this presentation is to give you a basic understanding of the types and benefits and the differences of Social Security Administration benefits, SSDI, SSI, survivor benefits. Typically, in my area, SSI is the main benefit. However, there are times when SSDI, the disability or survivor benefits, may have a better advantage and better payment and less restrictions than SSI. So that's why I'm including those as well. The effects of earned income, we're going to give you it has a little breakdown and subtraction adding example. The definition of substantial gainful activity, that's always a good question I get. And the threshold of income and assets for SSI eligibility and the impact on Medicaid. Next. Terms and resources. These are some terms that if anybody's unfamiliar with them, then here they are. Entitlement program. Social Security Administration runs the entitlement program, meaning if you qualify, you are entitled to it. I don't know if it's automatically, but nonetheless, and resources. I tried to, in every slide, I included a link to the resource and the origin of where I got it, because Social Security has recently updated some things. So I figured it's better for you to have the link than to refer to my 2024 presentation. Benefits limited for this presentation. SSI is Supplemental Security Income, and that pays the benefits based on financial need. SSDI, it pays benefits to the insured and dependents or disabled adult child. What I mean by insured is that person has worked enough quarters. How Social Security determines how much your payments will be, your benefit will be. It's based on how much insurance you've paid, basically. And that's kind of the analogy there, why they say insured. You've worked so many quarters to gain a certain amount of the pool, and then they say, okay, this is how much you're going to get. Social Security, so that's Social Security disability. And Social Security survivor benefits, the child's benefit is similar in the fact that they want to see how much the parent has paid into the system to see how much they qualify for benefit payments. And then for the child, if the child, obviously it does pay for the minor, but if it also pays to the unmarried adult child with a disability, as long as that disability began before the age of 22. And next. All right, SSI. SSI is paid to eligible people with a determined disability. I'm going to move this because there we go. All right. Who have limited or no income and or resources. By income, meaning they don't have any earned income, they're not working, or maybe little income. The resources, meaning assets. Do they have bank accounts? Do they own property? Do they have an inheritance? It's means tested. It's based on your means. For 2024, the maximum benefit per month is $943. And for the substantial gainful activity threshold, it's $1,550 a month. And I do have a slide after this that talks about substantial gainful activity, so we'll address that after. The benefits may be reduced because of living arrangements. And Dina, you can certainly speak up for people as well, but as far as living arrangements go, I know a lot of parents don't want to charge their children rent. And some people are like, yes, it still costs money to have the child at home, adult child. And so there's rent. SSI bases the allowable, I guess, acceptable rent based on their fair market value. That's why I have that link, Understanding SSI Living Arrangements. That will take you to, or I don't think, it'll take you to the link where it'll explain, hey, this is how we look at living arrangements, who you're living with. Once the person turns 18, they're an adult. Their benefits are no longer dependent on parents' income. However, it does depend on how much they're paying as a person who lives in the household with other people who live in the household. So if there are two parents and the child, their fair market value would be 1/3 of the housing expenses. Little caveat, if your housing expenses are $10,000 or $9,000 and their fair market value would be $3,000, Social Security is going to be like, they're going to have to move because somebody making $943 a month can't afford to live there. So fair market value, it seems like an oxymoron, but at the same time, you need to reduce it to a point if they're going to live in your home, what would be a fair market value? Maybe the room. And if any of you own businesses, there's a safe harbor, which would be that 1/3, but it's not safe here. But you would say, okay, this is how much space they take up in the house, how much utilities would be attributed to them, food as well. If they are paying less than their fair market value, then their benefits, which start out at max, would be reduced by 1/3. So if they're not paying their fair market value of rent or household expenses, then the benefit will automatically be reduced by 1/3 because the benefits are for housing and food. If someone else other than the applicant pays for that person's food, again, that's another 1/3. So if any of you have gone through and you didn't tell them that you're charging rent, or they say, well, who pays for their food? And you say, oh, we pay for their food. And so you're not getting that maximum amount because there's no reason for Social Security to pay for that if you are. But at least they only reduce it by 1/3. It's not the entire amount. All right. And we go next. Yes. So how does the amount of income for themselves, for that applicant, how does income affect the amount of benefits received? How Social Security determines it is they subtract any income that they don't count. And this is actually straight from the website, right? That bottom link. They don't count from your total gross income. And so there's a countable. So what they do is so if they're earning income, if they have a job, a part-time job, they say, okay, well, you're earning, the next slide actually has we can go to the next slide. That probably would be a better example. This is a definition and the next slide has the example. So the substantial gainful activity this year is $1,550. If your person can earn $1,550 or more, that's a threshold, then they're not going to qualify for SSI. because that's substantial gainful activity. So if they're making 1550, and I'm not going to give you why they deduct 20, I'm not going to give you why they deduct 65. I'm not going to tell you why they divide by half. It's actually right there in that link where it talks about how they count what's countable and what's not countable. So this is the formula. They say, okay, you're making 1550. We're not going to count the first 20 bucks. We're not going to count $65. So basically your income is going to be 1465. Well, then the rules for Social Security say you divide that by half. So we've got 732.50. Then the next step is they say, okay, 943 per month. And I see the little thing per month. I did have it on the other slide, but nonetheless, 1550 per month. And so they take 943 per month, which is the benefit, maximum benefit. They subtract the countable income of that monthly income, 732.5. And the federal benefit that they would get is 210.50. So they're not getting more than that 943. All right, next. Do we have any more questions on that? I did see the one when someone says, what? What are you talking about, Lisa?
So the 1550 is per month. Yes.
Per month. Mm-hmm. And I certainly don't mind exclamation points. I am a very animated person myself, so bring it on. It's all good. As Denise knows. So I see you there. All right, so SSI and Medicaid. In Florida, an adult child who gets SSI benefits is automatically eligible for Medicaid. Once you apply for SSI, they say you're eligible, you automatically get Medicaid, you'll get something in the mail. I have not received anything in the mail, but that is how it's supposed to work. If anybody in this group has had a different experience, I'm definitely open. I would love to hear about it because we need the practical what's going on if it's different than what it's supposed to be. The maximum amount they can have in assets is $2,000. This has not changed since 1984. They have not raised basically the resources for poverty. They say you cannot have more than $2,000 in cash or liquid assets total, bank accounts, anything.
Is that per month or per year?
That's total. Like you can by the end of the month, and this is just in the bank account. So if you have a bank account and say like today's the 17th, and you have say $5,000 in that person's bank account, by the end of the month, it's got to be less than 2,000. As long as, and it just spend. What do you spend it on? I know somebody has asked about ABLE accounts, and we can certainly talk about that in Q&A. But there are ways to make sure if you're unable to find things to spend it on, then, an ABLE account is always a great way to just kind of get rid of it quickly, just to make sure that their resources are less than 2,000. And of course, as most of you know, if not already, you can get Medicaid and Medicare at the same time. There is, I believe, still a 2-year, actually I just checked, 2 years after getting SSI for 2 years, you can get Medicare. Next. All right, substantial gainful activity, this wonderful enigma of a phrase. To be eligible for disability benefits, a person must be unable to engage in substantial gainful activity. So if someone is earning a certain monthly amount, say $1,550 for 2024, is ordinarily considered to be engaging in substantial gainful activity. I'm taking this right from Social Security's website, and I've got that link right there. So if at any time, say 2025 comes, you're like, well, gosh, what is it now? Pull up the presentation, go to the link, it's right there. I mean, of course, you can Google or search Social Security too. If the person can work and earn more than $1,550 a month, they're engaging in substantial gainful activity. And I understand people are like, what? That's not fair. But if you're looking at how much someone's going to earn in a month, $1,550 or $1,551 is definitely greater than $943. They could still qualify for Medicaid because $1,550 a month is still poverty. So they just wouldn't be getting Medicaid based on SSI. It would just be a separate application for Medicaid. And obviously they wouldn't, with Medicaid, has that $2,000 limit as well. So whether it's SSI or Medicaid, they can't have more than $2,000 in their account by the end of the month. If there's more, then there's going to be a payback, but that's not what this presentation is about. So,
real quick, we have a question.
Mhm.
Is getting Medicare automatic after 2 years, or do you have to apply for Medicare?
You know what? I was looking it up last night to look, and oh, Denise, I was gonna ask you, Denise, if you wouldn't mind. You're muted.
Oh, hang on a second. Let me, who is?
Denise Torres.
Okay, let
Yep.
me, all right. You need to go ahead and
There you go.
unmute
Is it
yourself.
unmuted?
There you go. Yes.
It's not always automatic, but it does happen automatically. You'll get notice, like if somebody's working and they've worked and earned enough credit, all of a sudden you get an email that says this, I mean, a letter that says this person has now earned his own disability. So you could get a letter. But I would, if you haven't received it, it's been 2 years, I would reach out, because Social Security is as bogged down as any government agency. And if you're eligible, it could take time. So I would definitely reach out. If you're not notified beforehand that you're becoming eligible, I would reach out to them.
Yep. And it is
Required age for Medicare?
no.
Okay.
No. There is, and I'll pull up one of the links as well, because I'm not saying SSI and Medicare. I'm saying you can get Medicaid. Just to correct Sarah Sullivan, I understand what you're saying. I'm just saying you can get Medicaid and Medicare at the same time.
Yes.
So there are other programs, but I do appreciate the information, Sarah. Thank you. All right. Next slide. Okay, SSDI benefits. Again, I have the links at the bottom of the screen. SSDI, it is, these are benefits of eligible people with a qualifying disability and who have worked long enough. And again, those quarters. Child benefits, minor dependent. If they're a minor, they can get benefits based on their parents' disability. It's an adult child, they can get benefits based on their parents' disability insurance income. And then the adult child can be eligible for up to 50% of that disability amount. As far as who's eligible, they can be biological, adopted, or a stepchild. And again, all of this is straight from Social Security. So if anybody has any issues or wants to say something different, please let me know, and I'll certainly pull up the link, but that's exactly where I copied and pasted. So the adult child must be unmarried. Once they're married, the benefit ends. Benefits are, again, based on the parents earning, not the disabled adult child. And they must not have substantial earnings. I put substantial earnings because in the Social Security website, it doesn't say substantial gainful activity. It says substantial earnings. And I didn't want to get into what that means for SSDI, because we're really just talking about the different types and how they're different of the benefits. So, all right, next. All right, survivor benefits. I know we had a question earlier. I think Dina, you had sent me one. They are benefits for survivors of eligible people who have worked long enough and are deceased. Again, child's benefits, minor dependent, adult child, disability began before the age of 22. You can get it at any age. However, if you're not currently receiving the benefits, you must apply for these survivor benefits within 2 years of the date of death. Again, link at the bottom of the page if you have any questions or wanted to look into it more. The adult child benefit is 75% rather than the 50%. For the disability, again, can be a biological child, adopted, or a stepchild. And in certain circumstances, grandparents, but for children, that's what we're talking about today. Again, must be unmarried. Married, benefit ends. Same, must not have substantial earnings and based on the parents and not the disabled adult child. Next.
We do have one other question. If a disabled adult receives 1,186 per month, does the disabled adult lose SSI?
Well,
is that where the 1,500 comes in per month?
Well, no, because the 1,550 is earned income. substantial gainful activity. And that's unearned income. So I didn't pull that up, but I can pull that up on, I mean, Sarah Sullivan, if you want to pipe in here, I'm fine with that as well.
Okay, so adding to that, that is adult support from the father of the disabled adult. So they're getting that support, so it wouldn't be earned income. Then would they lose their SSI?
Well, I didn't really include, and I will say I just did a basic, and I'm not, I don't know, actually, at the top of my head, I don't know. When it comes to these, I look it up. Oh, Denise, thanks.
I'm sorry, if the payment they're getting is greater than SSI from it, then the dollar amount does matter, and they may not get a single penny. They're supposed to at least be eligible for $1 in SSI to keep Medicaid. They can't lose their Medicaid because in the state of Florida, they need to be able to be on Medicaid for the med waiver. But this is a kind of a tricky question because you have to be able to look at how many months they earned sustained gainful activity, and there's different things they do. But if you are making more than the SSI payment is, then usually there's no reason to give you SSI. You're making more than that.
Exactly, the balance.
Yeah, so, but the Medicaid is what's important for our kids. So this is a bigger, if you don't have a benefit query thing, and I don't know if Lisa was going to mention it, but you can get that and you can see if your kid is working and if they've ever earned. My son's been working for 15 years. He has never in a single month made sustained gainful activity, the amount for whatever year it was. So, but some people work 30 hours in Publix. They could be doing it quite often. So it's a case by case, and you need to get this query so you know if your child is at risk of losing their benefit.
Right.
Hey,
And
Lisa, can I
yes.
answer really quickly?
Sure.
Okay, so the question is, can a child receive SSA survivor benefits and SSI at the same time?
Right.
And my first instinct was it depends, which is such a lawyer answer, and I'm sorry for that. But based on this question, it depends on how much those survivor benefits are. And survivor benefits, they call them auxiliary benefits if you start looking into Social Security. But let's say, for example, you're only getting $400 a month in survivor benefits, then you would get the remaining up to the $943 for SSI, and you would get eligible for both Medicaid and after 2 years, Medicare. If your survivor benefits exceed the $943, Social Security wants you to take what they call the higher benefit. So, and they want people off of SSI if they can and get them on to SSD because they come out of two different piles of money. So, but they have that initial Medicaid eligibility, which probably a conversation for another day.
Well, and that's why I didn't, that's why I didn't include it in this presentation at all, because I'm like, it's a rabbit hole. It's a rabbit hole.
It is. But the answer is yes, you can get both up until you hit that 943 SSI threshold, and then the SSI drops off. And so anyway, so thank you for reaching out and letting me clarify that. I appreciate it. I didn't mean to derail stuff.
No, it's okay. I didn't want to make this a legal advice presentation.
Yeah, right.
Which is why I didn't want to answer, and that's why I was hesitating, because I always love to help people, but at the same time, I know this is not about giving legal advice. Although I do see
Sarah,
maybe somebody else. So yeah.
Sure.
All right.
The next one?
Yes.
Okay.
All right. An example of somebody getting, and this is again, right from Social Security. A worker starts collecting Social Security retirement benefits at age 62. He has an unmarried 38-year-old son who has CP since birth. The son may start collecting the benefit on the father's Social Security record. It's not necessary that the child ever worked. The benefits are paid based on the parents' earning records. So that's just an example of getting a child benefit for a disabled parent or retired parent. Next.
And let's go back one other question. We're talking about benefits. So one is what is considered substantial income for survivors' benefits? And then two, is support, such as child support, I guess, considered as income?
Support is, yes, support is income. And again, this is, you know, I with these specific these fact specific questions, I don't have time to, this is not a legal advice. So it
We
does
can
kind of,
just have people send them to me and I will forward, we could do it that way, because I know we're
Yeah.
trying to keep just a broad general overview.
yes. And I'd rather not, because even if somebody's answering questions in the chat, I'd hate for it to become legal advice from anyone.
True.
Because it would not apply. It doesn't apply across the board. People's situations are different. There are different facts. You know, I just want to make sure that that's clear. I do see there being helpful people there, but I'd rather, sometimes there are different strategies and ways to assist to obtain benefits and keep benefits. So I just want to disclaim any kind of advice that's happening in the chat. Just all right. So again, this is brought, I didn't realize we were had to set aside an hour, Dina, but I did want to, I figured Q&As would probably take longer than my my presentation. And again, I do know the question was, what is the substantial earnings for survivors? And I'll go to my presentation and pull up the link, because that's basically, let's see, here was my presentation.
Do you want to share your screen with the link?
Let's see here. Maybe let's take this up. Let's see here. Let me pull it up first. Let's see here. Survivor benefits. Okay. Yeah, I mean, I can, let's see here.
All right, I'm going to, hang on a second. I'm going to make you the host so that you can share
Mm-hmm.
your screen. You should be able to share it
Okay, let's see here. Let me get to,
so that everyone can see.
yes, all right, so I'll share and screen one. Okay, so these are benefits for children with disabilities. Let's see here, there was a survivor.
And if you would, Lisa, if you would
Mhm.
email me the link when I send out a copy of the presentation, I will be glad to send
Mhm.
the web links as well.
They're live
Are
links.
they in there? Okay,
In the presentation. So if you're emailing the presentation, they'll have the links.
great. Okay.
And click on those. So this is basically what I do when I put a presentation together, and I look because I want to get everything from the horse's mouth. The key with Social Security is to make sure you're paying attention, and you're working with a lawyer. You don't need a lawyer, an attorney to apply for the benefits. It's not required. If you're denied, you can still do the reconsideration request. I definitely recommend probably talking with an attorney about it, because we definitely can review your evidence and say, hey, what did you provide? Social Security benefits are given based on evidence of the disability or evidence that you paid into the system. The evidence should include everything. And, I would say as a lawyer, I like to win, but as a person, I just like to win. So I want to make sure that I have all of the evidence that they need. Let's see here, earnings. Just, substantial earnings. There we go. And where's the survivor benefits? So these are people with blind, which is why I didn't want to say exactly, but let's see, surviving. They said earnings. It could just be the 1550, but I would, if someone was asking me about it, I would probably dive a bit more into what was happening to find out the exact, but substantial earnings is typically the 1550. The reason I didn't include 1550 in that because it said substantial earnings. And as as I'm sure Sarah can agree, if it's what it says, it's what it says. And they've said substantial gainful activity in other places, and they only said substantial earnings here. So I didn't want to just do a blanket substantial gainful activity earnings, just to clarify that. But this is, I'll go to the top so you all can see. Disability, how you qualify, how much work do you need, what do they mean, qualifying disability. There's the 5 questions, and then these are the 5 questions that they ask. One of the things that I do typically recommend that parents do is, as far as evidence goes, they need to see what is the evidence of the disability. And Social Security is going to need to know, how does that disability impact or affect their ability to engage in substantial gainful activity? Are they able to earn $1,550 a month despite the disability? So that is one of the things, that's the evidence that you need to provide. Whether it's for SSI or you have an adult child looking to receive benefits based on the fact that they have a disability that started before their age of 22. And again, like Denise said, if they're earning money, you just balance that out as to what's better. So SSDI, the disability based on the parent's disability, that is, there's no resource requirement. SSI is the only one of those that has the resource requirement, the $2,000 limit. SSDI doesn't have it. And I'll put it this way, I didn't see it in there. Sarah, correct me if I'm wrong. But there's no resource limit on SSDI or survivor benefits, but there is that income requirement. If they're earning income, that's going to either reduce or end the benefits. All right, let me go back to the chat. So I think we kind of settled on, as far as the income, substantial earnings, $1,550 for non-blind, $2,590 for blind. Let's see here. And so I go here and I'll go, if you're looking for, just to show you, if you're looking, it's a huge website. It has so many resources and information, but you could say, let's see, child support.
And
So
again,
if
when in doubt, consult a lawyer.
Mhm.
Yeah, absolutely. And so Lisa, sorry it took me a minute to unmute myself. So SSI is Supplemental Security Income.
Right, it's on the web. It's on the presentation.
Yeah,
Yes.
it's on the
Yes.
thing. Anyway, so that is based on people that have not put their 40 quarters into the system. So these are people that have never worked or haven't worked enough. And so it is basically, I always say it's kind of, so it's for people that haven't put the money in.
Well, it's right. It's based on low income. Right. It's on this.
Right.
It is in the presentation. It does say, you know, yes, there. Mm-hmm.
And then you've got your SSD that is goes, you know, you can either get a survivor benefit, you can get it yourself if you're disabled before your retirement age, but it's in that pile of money.
Right.
I mean, yeah.
I'm sorry. And I was actually just asking for you to pipe in if there was a resource limit for SSDI and SS survivor benefits.
Thank you. You got me. So no, there is not.
Okay.
I was
saying, correct me if I'm wrong. That was always it. Correct me if I'm wrong, but there's,
So I think now I need to actually introduce Sarah Sullivan because she has jumped on graciously. So she is Director of Life Path Planning and Management at the ARC of Jacksonville. And she has presented for us as well on different topics. So I guess I just wanted to give you some credit, Sarah, since you were
oh, absolutely,
in the gaps there.
Mm-hmm. And of course, Denise Torres, thank you very much.
Yes, with the ARC of Jacksonville as well. She is very knowledgeable in this arena as well. So
yeah. And one of the things with Social Security is it depends on who you get sometimes when you're interviewing for benefits.
Right.
You know, I'm sure how many people are in here? Over 60 people, I think, are in this 115 people are in this
115
presentation
right now, yes.
I am sure every single one of you who have applied for Social Security have a different story as to what you went through to get those benefits.
Mm-hmm.
I mean, it's that again, that was just basic. That's another reason as far as what it is. I have some parents who have applied for SSI because there's not enough working quarters. And they'll say, well, they weren't disabled, even because their FSIQ was 73 on one of the levels, but it wasn't the full scale. It was just in the report, there was a 73. Everything else was like a 59, 60. And they said, well, we're going to deny because there's a 73. They're not under the limit. And so, of course, we had to, go through, gather all the information, get another doctor's report. And then there are other people that had a child getting benefits before 18 and they never had to reapply after 18. So it's like on both ends of the spectrum. And although I haven't heard really any horror stories with SSDI, getting children getting benefits based on their parents' disability. No, Sarah, you're the bomb. That's why I was like, come on in. But we do go down rabbit holes when it comes to these topics for sure.
We did have a question about the benefits of enrolling in an ABLE account.
Yes.
And if those monies, and if any monies from the SSA survivor benefits can be put into an account, or if all the deposits must be from other sources.
Nope, ABLE account can take in any monies from any resource. There is a limit on their annual amount, and I haven't looked. I'm not a representative of ABLE United, but it's ableunited.com. If I'm still sharing.
No, okay. No, I'm sorry.
No, that's okay. I didn't know if I was or not. That's all. Yeah.
I relinquished control so that I could monitor that.
Yep, perfect. So, but the ableunited.com is the website. To apply for an account, it's like 12 minutes. I did it once with a client of mine. It was 12 minutes. Probably would have been maybe 9 if she had done it on her own because she just didn't need to wait for me to ask her questions. But very easy, very simple to do. And the money from the ABLE account can be spent. Thank you, Dean. Thank you. The money can be spent on a lot of things, whereas, and again, I don't want to go down a rabbit hole, but with ABLE United, when it comes to the living arrangements, if you're going to go to the Understanding SSI living arrangements, and if the Social Security person asks you, hey, does this person pay rent? Yes, they do. And you can say, or yes, they do. The money, if somebody else wants to pay for the rent and you don't want to use their Social Security for it, it can be paid from the ABLE account and not affect their benefits. It's a wonderful lobby group that apparently got this passed in Florida and other states as well, but that is one thing that won't affect their benefits with rent, with Social Security. If the ABLE account pays for the rent, you can put Social Security into ABLE account, you can get their check from SSI, you can put it into the ABLE account. I wouldn't recommend it because if, God forbid, something happens, all of the money in the ABLE account, there is no beneficiary allowed. So if the person passes, regardless of what our government says, without being a Medicaid payback on the account, it goes to the estate. So in order to get that money, and you open up a probate, you've got a probate, which is the proceeding to get another person's property after they pass. Then Medicaid's going to make their claim for all the money that was paid on their behalf. So there's still a Medicaid payback with the ABLE account. It's just behind the scenes.
And I did put in the chat, we had John Finch with ABLE United present at a lunch and learn probably March or April of last year, and it is on our YouTube channel. So you can, the actual presentation, the webinar, so you can go and look at that, and you can get to our YouTube channel from our website. But I did put that in there. So Lisa, because, you're the lawyer and I am not, I'm gonna let you look at the questions in the chat. and
Okay.
see which ones that you can answer broadly and generally,
hmm
as we do have, about 20 minutes left.
hmm
If you have a question, have everyone just kind of put it in there and, we will answer it that way.
Let's see here. Let's see.
One, do you
If it-
recommend, any others over able accounts?
I don't know. I mean, for able accounts, I mean, if you're looking to sign up for able, let's see, we do not have. Oh, you're not required to sign up for an able account. And many people, choose not to do able accounts. They want to do, say, like a supplemental needs trust for their children, to, leave a legacy for them.
Mhm.
If you do a special needs trust where it's your child's money and they're getting Medicaid benefits, then yes, it would have to be a Medicaid payback trust. Because Medicaid or Social Security won't allow them to just kind of transfer money away and saying, don't pay attention to this money that I have. They'll say, no, there needs to be a Medicaid payback for Medicaid. But
and I know that we, our family, have an able account for our daughter. We also have money in a pool trust for her, and on our death and our wills, a testamentary trust where everything's written out. So different options to look at. And we did speak to 3 different people about those 3 different things. It's not something I just, did on a whim. So I can certainly,
yes.
provide input just of who we use and what type of person. So.
Let's see here. When does a 2-year waiting period begin for Medicare? I just had it up and I wish I could memorize everything that I learn and read, but that's why I don't, because I can look it up. So if Sarah or Denise, if you have an answer for that, I'll certainly defer to you, but while I'm looking on the website. One able account versus another. Versus another account, or?
Well, there's a question about one able account versus another.
That's what I'm wondering, because there's only one. Oh, I mean, I know that on the Able United, you can choose, I guess, the investment. So I don't know about that. I'm not a financial advisor. So if that's what you mean by the one account or another. How can you get a summary of all monies to date Medicaid claims they've paid? I don't know that they'd give that to you, but I guess you could just contact, I guess the Medicaid office. Well, I mean, I don't know if the My Florida Access has that information. If you go online, I've never requested that. When I do probate cases, they just file it and then they say, hey, this is how much we've paid. So I've never independently requested that. But I would imagine I would just, if I was looking for the information, I would call the Medicaid office or I'd go online, because they never answer the phone when I call. And
True, right?
But they do have a chat. I know they have a chat as well online, but that has been kind of helpful for me. So you might want to check with them. You always have to report work income. You always. As an attorney, we're not really able to say always or never, but in this case, always. If Social Security finds out that somebody has been working, and they're going to go back and they're going to say, well, how much have we overpaid? Because that person never reported.
Mm-hmm.
And then they're going to say, well, you're not going to get any benefits anymore. Let's see. So if it's $943, then we're going to say, well, we're going to take out maybe $500 a month. They'll try to do what's reasonable, but they're definitely going to take out the overpayments over time if it's not paid. Mm-hmm. If you move to a different state, I would definitely contact that new state, because Medicaid is a state-run program, and with Social Security, most of the states once you apply for SSI, you'll get Medicaid. But there are definitely other states that don't. That's not how they figure eligibility for Medicaid. So definitely reach out. I know for Florida, SSI, automatic Medicaid, but somebody's transferring from another state, it doesn't have it that way. You know, so we've got to call SSI, notify them, and reach out to Medicaid here in Florida to make sure that everything is working out. It's a little work, but it's worth it.
I think that was all the questions that we answered that you could answer. So here's one that just came in. Do we submit the evidence of disability with the application for SSI? Where do we get the help with filling out the SSI application?
Well, I actually did just go over this the online with a client of mine, and it was actually the first time I'd actually gone through the process with a client. And all it was we filled out the information, and then they said, okay, we'll contact you for an interview. So if there's help, there's really, I mean, you don't really need any help online, but when you go for that interview, yes, bring everything. If you say, should I? Yes. Don't even finish the.
Denise, do you want to comment?
Yes. Yeah.
She has helped.
Mm-hmm.
Hang on, you need to unmute there. Wait, there you go.
Oh, okay. I just want to, as a person, like Lisa said, you can do hundreds of different variations of how everybody's situation went, and there'd probably not be any two stories. It took me 3.5 years to get my son's Social Security SSI when he had autism and an intellectual disability under 70. He was eligible. He met the listing. So what I like to do is I like to show parents that call me, this is what you have to prove about your son. It's a factual company. APD says you want to claim a person has Down syndrome. There's actually a listing that tells you in the developmental mental health areas where what APD says, what Social Security says meets the listing. And we're happy to talk to families about that, because I used to do that before, where I would take them through the listing. For autism, you had to have periods of decompensation. How many people know what that means? You know, they're having hissy fits. They're out of control. You've got to be able to document to Social Security. In teacher exchange notes, in IEP meetings, in your records, that the behaviors are out of control. That's how you do it. So if you say, oh yeah, so it's really good to have a conversation before you just go and look at what they're looking for. Give them the facts clearly. Give them the whole record, but show them where the facts are. What date was the autism diagnosis? What doctor made him? Social Security does not make the evaluation of a disability. The Department of Disability Determinations does that. So they're just the passing people. So if you give it to Social Security, you run the risk of possibly a placement of papers. Keep copies of everything you provide. That's all I want to say. Never give them originals, and do not give them your only copies. Because it may be the last time you ever see it.
Yes, and they'll say they'll say we never got it.
Yeah, well, it's a good idea too, especially for young children with disabilities. For parents, is just start a folder, notebook, whatever. Anything you get written on it with anything related to what may or may not be a disability or may not come to fruition, keep it, because you need to know. You're going to have it at some point. So it's a good idea. And then, yeah.
Mm-hmm. And for the listing, I actually did include on the terms and resources page in the presentation, it's disability evaluation, see the CFR, it's ECFR, right? And it has a listing of the disabilities that if they qualify, then it's an automatic determination. Yes, that's a disability. Then they go to the next evaluation of how does that impact their ability to work. So there's that. Yeah, it's bring it all, but bring copies. So
yes, And so, like I mentioned in the chat, we are going to be sending out a copy of Lisa's presentation. It does have her contact information in there. We will be putting a recording of this webinar on our YouTube channel by the end of the week. I will put a couple web links in the email as well. But if you have any other questions, feel free to reach out to Lisa, or you can email me, and then we will get you the appropriate answer or person to speak with, for sure. And I'll go ahead and I will put my email in the chat as well. And I think we've answered all the questions, unless you see any that we missed, Lisa.
I don't think so. I was just going to do a recap of the differences with SSI and SSDI. So if you're wondering which benefit program you should apply for all of them.
Yes.
It doesn't hurt. And Social Security even says you can apply for both at the same time, because they're going to evaluate. So, I mean, obviously you want to make sure you can maximize the amount of benefits that your person receives to get the best quality of life. So.
All right.
I think, Lisa, if I could just say something about that, that's a great plan. You get notification. You got to pay attention to the titles of the letters, though. Supplemental Security Income. Pretend it's Walmart, SSI. Walmart is writing you. Social Security Disability Insurance, SSDI. Pretend it's Target. Target's writing you. A lot of people would say they get denied right away because they're not eligible for SSDI. So it's a denial. That doesn't mean the SSI was denied. So there should be another letter that comes.
Thank you.
You've got to keep those things separate. It sounds like it's the same thing, but those two parts of the agency handled differently. So you should be getting, if you apply for both, you should consider 2 packets of information will be coming. They don't work together. So.
Yep. That's true. And you're right, because I did have a client say they were denied. And I said, well, what did you apply for? They said SSI. And I'm like, they said he didn't work long enough. And I said, then that was not SSI. So disability insurance income, disability income is SSDI is earned, working earned. So, and Amanda, I'm sorry, I'm not going to answer your question. I'm letting you know I'm not going to answer because
it's legal.
Well, because that was the example I gave earlier. I had one person who they had to reapply when their child turned 18. And then I've had other people say, I never had to do anything new. They just kept sending me.
It all depends. So,
yeah.
And sometimes it's a presumptive benefit. They know from the child's condition that it's not going to change. So it's a presumptive benefit and it'll flow in. But others, autism does change. And so they're less friendly about that. Things might have improved. You got skilled. So again, like she said from the beginning, everybody is different, and you can't. My friend, I knew people way less disabled than my kid, and they got Social Security. I mean, that's how I felt when he was getting denied. That's exactly how I felt.
Mm-hmm.
Our daughter got denied at first. So I mean, it's not uncommon to get denied.
That's why you got to address the facts. What are they looking for, and provide them that information.
Mm-hmm.
Right.
And it's easy. My dad used to work for Social Security, and he said, Lisa, we actually tell you what we want. We give you a list of the disabilities. We're telling you exactly what we want and how we want it.
Right.
So don't disregard it and put emotion into it. Just give them what they want. And I do see ARC does help with that as well. So.
Well, again, Lisa, we thank you so much for taking the time, and we hope that everyone will join us in February and keep following us on social media, and we will send out further meeting announcements. So look for an email this afternoon from me with the presentation, and then you can view on our YouTube channel by the end of the week.
And thank you. And thank you again for having me. And thanks for everybody for sticking around and listening. I hope it was helpful.
Great. Thank you so much.
Thanks.
Bye-bye.
Bye-bye.